You may believe that the more medical checkups you undergo, the healthier and safer you will be. But the truth is that after the age of 70, some common health screenings may do more harm than good. Many older women think that continuing every test they have done for decades is the best way to protect themselves. Yet medical research shows that certain tests at this age bring higher risks, unnecessary anxiety, and even dangerous complications, without providing real benefits. I have seen patients frightened by false alarms, exposed to unnecessary biopsies, or harmed by procedures they never truly needed. The mistake is believing that all screening is always protective, when in fact, beyond a certain age, the balance shifts. What once helped detect disease early may now increase suffering and lower quality of life. That is why it is critical for women over 70 to know which health checkups are best avoided. In this video, I will reveal 5 common tests that older women should think carefully about. I will explain why their benefits shrink with age, how they can cause harm, and what safer alternatives exist. Before we begin, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. And if you find this information useful, type 1 in the comments. If not, type 0 so I know how to make these videos better for you. Part 1. Full body cancer screenings that trigger false alarms. The first checkup that older women should avoid after 70 is the full body cancer screening. On the surface, it sounds reassuring. A scan that promises to find hidden cancers anywhere in the body. In reality, these scans, whether they are whole body CTs, MRIs, or PET scans, often create more problems than they solve. The reason is that the older we get, the more likely our bodies are to develop harmless abnormalities. Small cysts in the kidney, tiny nodules in the lung, or benign growths in the thyroid become increasingly common with age. A full body scan can detect these incidental findings, but the scan cannot always tell if they are dangerous or harmless. The result is a cascade of false alarms. I have seen patients subjected to multiple follow-up scans, painful biopsies, and even surgeries for spots that would never have harmed them. Each step brings risk, radiation exposure, and emotional stress. Imagine being told you might have cancer, waiting in fear for weeks, only to learn that the finding was insignificant. That unnecessary anxiety alone can damage health, raising blood pressure and disturbing sleep. And the physical risks are real. Repeated CT scans expose patients to high doses of radiation, which over time can actually increase cancer risk rather than prevent it. PET scans require radioactive tracers that stress the body. For frail older women, these procedures can be exhausting and even dangerous. The truth is that there is no evidence that whole body cancer screening improves survival in healthy women over 70. Cancer screening should always be focused and individualized, targeting the organs where risk is highest and only when treatment would truly help. For example, a woman with a strong family history of breast or colon cancer may still benefit from targeted screening, but a healthy 75-year-old with no symptoms does not need a full body scan. The safest approach is to discuss personal risk factors with a trusted physician, not to rely on broad, one-size-fits-all tests. The lesson is simple. Full body scans promise peace of mind but often deliver false alarms, stress, and unnecessary procedures. After 70, older women should be cautious and avoid this type of checkup unless a doctor has a very clear reason If this has surprised you, wait until you hear about the next checkup. One that many women have done for decades, but which after 70 can cause more harm than good aggressive mammograms. Part 2. Aggressive mammograms in advanced age. The second checkup that older women should carefully reconsider after 70 is the aggressive use of mammograms. For decades, women have been taught that yearly mammograms are essential for catching breast cancer early. And in middle age, this is often true. But as women grow older, the balance between benefit and harm begins to shift. Breast cancer does exist after 70, but the growth of most tumors is slower. And the chance that an older woman will die from another condition, such as heart disease or stroke, is actually much higher than from breast cancer itself. This means the benefit of detecting small, slow-growing tumors declines with age. What does not decline, however, are the harms. Mammograms in older women frequently produce false positives, findings that look suspicious but are not dangerous. These false alarms lead to stressful callbacks, additional imaging, and invasive biopsies. Each unnecessary procedure carries physical risk and emotional toll. I have seen women in their 70s frightened for weeks, only to learn that the suspicious spot was nothing more than scar tissue or a harmless cyst. The anxiety, sleepless nights, and repeated testing weaken rather than strengthen health. Radiation exposure from repeated mammograms also adds up over the years. Although each individual dose is small, cumulative exposure is not without risk. For women who are already frail, the stress of the procedure itself, the discomfort of compression, and the worry about results can outweigh the benefit. Medical guidelines in many countries now suggest that after 70, routine mammography should not continue indefinitely for all women. Instead, it should be tailored. Women with a strong family history of breast cancer or with genetic risks may still need ongoing surveillance, but many healthy older women do not. In these cases, mammograms may uncover very slow-growing cancers that would never have caused harm in a lifetime. Yet, the diagnosis can lead to surgery, radiation, or chemotherapy that damages quality of life. This phenomenon is known as overdiagnosis, and it is a significant problem in older women. The lesson is clear. Mammograms are not automatically beneficial after 70. They should be considered carefully, based on individual risk, overall health, and life expectancy. For many women at this stage of life, continuing aggressive mammograms does more harm than good. If this has opened your eyes, wait until you hear about the next checkup. One that is uncomfortable, often dreaded, and almost always unnecessary. After 70, the routine pap smear. Part 3. Routine pap smears past recommended age. The third checkup that older women should avoid after 70 is the routine pap smear. For many women, pap smears have been a regular part of life since their 20s or 30s, designed to detect cervical cancer early. During midlife, this test has saved countless lives by identifying precancerous changes before they became deadly. But after 70, especially for women who have had a history of normal results, the benefit of continuing routine pap smears falls sharply while the harms remain. The reason is simple. Cervical cancer usually develops slowly, over many years, and women who have had repeated negative tests throughout adulthood are extremely unlikely to develop new disease after 70. At this age, the cervix has often undergone natural changes that make abnormalities rare, Yet many older women continue to be scheduled for pap smears out of habit, not because of medical necessity. The problem is that pap smears in this age group often pick up harmless cellular changes that are related to aging rather than cancer. These findings can lead to repeat testing, uncomfortable colposcopies, and even unnecessary treatments. I have seen older women subjected to invasive procedures for minor changes that pose no real threat, causing weeks of worry and physical discomfort. Beyond the physical aspect, the anxiety of being told there is an abnormal result can be devastating, especially for women who thought they were finally done with this test. Guidelines in many countries, including the United States and parts of Europe, recommend that women over 65 who have had consistent normal results and no history of cervical abnormalities can safely stop pap smears altogether. For women without symptoms and without a history of high-risk conditions, continuing the test brings no measurable benefit. The key here is individualization. Women with a history of cervical cancer, precancerous lesions, or suppressed immune systems may still need surveillance, but the vast majority do not. The lesson is clear. Routine pap smears past 70 rarely save lives but often cause harm through overdiagnosis, unnecessary procedures, and psychological distress. Older women deserve peace of mind, not repeated invasive exams that no longer improve outcomes. If this surprised you, wait until you hear about the next checkup, one that seems harmless but often leads to unnecessary medication and side effects. Repeated bone density scans. Part 4. Excessive bone density scans and overtreatment. The fourth checkup that older women should avoid after 70 is the repeated bone density scan, often called a DEXA scan, performed too frequently without clear reason. Bone health is a real concern as women age, since osteoporosis can increase the risk of fractures. But the truth is that after a certain point, repeating these scans every year or even every 2 years rarely provides new information, while it often leads to overtreatment. The main problem is overdiagnosis of osteopenia, which is mild bone loss that is common in almost every older woman. Osteopenia does not always progress to dangerous osteoporosis. Yet labeling it as a disease can trigger unnecessary prescriptions of strong medications. Drugs like bisphosphonates or newer bone strengthening injections can have serious side effects, including jaw problems, digestive issues, and even unusual fractures in the thigh bone. I have seen women placed on medication for years based on a single borderline scan, despite having no fractures or symptoms, only to suffer harm from the treatment itself. The reality is that bone density naturally declines with age, but not all decline requires medical intervention. In fact, guidelines suggest that once a woman has had a baseline DEXA scan in her 60s and results are stable, repeating the test more often than every 5 to 10 years is unnecessary, unless there are new risk factors. For women over 70, especially those without a history of fractures, repeating the scan frequently does not add value. Instead, it creates anxiety over small changes in numbers that may not mean anything clinically. Preventing fractures is important, but lifestyle measures such as weight-bearing exercise, adequate calcium and vitamin D, fall prevention, and balanced training are often more effective and safer than long-term drug therapy triggered by minor scan results. The lesson is clear. Excessive bone density scans can turn natural aging into a disease, leading to medication and side effects that harm more than help. Women over 70 should not feel pressured into repeating these scans frequently unless there is a strong medical reason. If this has made you think twice, wait until you hear about the final checkup. One that is especially risky in advanced age, the routine colonoscopy. Part 5. Unnecessary colonoscopies beyond the safe window. The fifth checkup that older women should reconsider after 70 is the routine colonoscopy. Colonoscopy is a valuable tool earlier in life, especially between the ages of 50 and 70, when it can detect and remove precancerous polyps before they become dangerous. But after a certain point, the risks of the procedure begin to outweigh the benefits. For older women, particularly those with other medical problems, colonoscopy is not as harmless as many believe. The procedure requires sedation or anesthesia, which can strain the heart and lungs. It also carries a small but real risk of complications such as bleeding, infection, or even perforation of the bowel. These risks grow with age. For a woman in her 70s or 80s, a complication during colonoscopy can quickly become life-threatening. The preparation itself can be exhausting. Drinking liters of laxatives to cleanse the colon often leads to dehydration, dizziness, or electrolyte imbalance. I have seen frail older women hospitalized with weakness and falls after attempting to prepare for a colonoscopy. Meanwhile, the benefits decline. Colon cancer develops slowly, often over 10 to 15 years. If a woman has already had normal colonoscopies throughout adulthood, and the likelihood of discovering a dangerous new growth after 70 is very low. Most guidelines now agree that after 75, routine colonoscopies should stop for women at average risk. Beyond this age, the harm from complications is greater than the potential benefit of detecting cancer early. Instead, safer alternatives exist. Stool-based tests such as the fecal immunochemical test, FIT, or stool DNA testing can provide ongoing monitoring without the risks of sedation or invasive procedures. For many older women, these non-invasive options are a better choice. The lesson is clear. Colonoscopy is not automatically protective after 70. It can expose older women to risks that are more dangerous than the disease it seeks to prevent. The decision should always be individualized, based on overall health, prior test history, and life expectancy. Blindly repeating colonoscopies into advanced age may cause more harm than help. If this has made you rethink what you thought was routine care, stay with me for the conclusion, where I will bring all 5 checkups together and show you how to approach medical decisions wisely after 70. Conclusion: 5 health checkups older women should avoid after 70. We have now reached the conclusion, and it is time to gather the 5 lessons together. Many women believe that more checkups always mean better health. But after 70, the story changes. Some screenings that once saved lives can now create false alarms, unnecessary stress, and real physical harm. The first is the full body cancer scan. These tests often detect harmless findings that trigger a cascade of biopsies, surgeries, and radiation exposure without any real benefit. The second is aggressive mammograms. While vital earlier in life, after 70, they are more likely to produce false positives and overdiagnosis, leading to treatments for cancers that would never have shortened life. The third is the routine Pap smear. For women with decades of normal results, continuing this test after 70 adds discomfort and anxiety with almost no chance of improving survival. The fourth is repeated bone density scans. Done too often, they label natural aging as disease, pushing women into medications with side effects more dangerous than mild bone loss. And the fifth is colonoscopy beyond the safe window. After 75, the risks of sedation, bleeding, or bowel perforation outweigh the small chance of catching cancer in time. These 5 examples remind us of a truth too often forgotten. Good medicine is not about doing more. It is about doing what helps. Screening should always be personalized. Every woman deserves care that respects her age, her history, and her overall health. Not a checklist of procedures done by habit. This does not mean ignoring health. It means focusing on what truly improves quality of life, managing blood pressure, staying active, eating wisely, avoiding smoking, and nurturing mental well-being. These are the choices that protect the heart, brain, and independence, far more than unnecessary tests. I want you to remember this. Your body still remembers how to heal, and your health decisions still shape your future. Ask your doctor which tests are truly necessary and which can be safely skipped. By avoiding unnecessary screenings, you reduce harm, conserve energy, and focus on what really matters, living well in the years ahead. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. If you enjoyed this video, type 1 in the comments. If not, type 0 so I know how to make better content for you. And do not forget to like, share, and subscribe so you never miss another health tip made just for you.